Dr. Ian here, Dr. Autoimmune. We're going to talk about gut health. More than just gut health, we're going to talk about how gut health impacts every system in your body. My name is Dr. Ian. Been practicing function, not just kind of showcase what I've been doing for the past 15 years, but literally actually just talk about, hey, why do people develop chronic issues? Why do people have gut symptoms? And then more importantly, what are we actually going to do about that? So functional medicine, if you guys aren't aware of what that is, okay? Functional medicine really is actually derived from numerous different principles in Western medicine, but actually also Eastern medicine as well. So it's kind of taken traditional and non-traditional, the diagnostics, really actually the ability to kind of actually speak to clients and hear their perspective, actually give people the amount of time so they can actually feel like they are being heard. But also what we're really doing is we're linking their symptoms to their systems. So obviously tonight we're going to talk about the gut, but every other system in your body typically influences the gut, but then also the gut actually influences other systems in the body. So we're going to talk about that, how again it's like an interconnected web of issues, whether it be environment, genetic, triggering issues, hormonal, right, nutritional, infectious, stress-based issues, blood sugar, all these different various issues are going to influence gut health. But then again, your gut is where we find about 70% of our immune system. So if you've heard me lecture before, you know I talk about gut health all the time. There's no way I can't omit. You can't omit the gut, because if 70% of our immune system is found in the gastrointestinal tract, and the barrier in the gut is literally one of the hallmarks that is predisposed, it's the predecessor of developing autoimmunity, right? Then we have to start to understand, well, why is the gut out of control? Now, again, the crazy thing is, right, and I'm going to say this numerous times, is that if you don't have gut symptoms, you're not out of the woods, right? Meaning that just because you don't have IBS or you don't have gas or bloating does not mean that there's not a significant component as far as your gut health. And so again, at the end of this webinar, you guys are going to understand, hopefully, about the numerous influences on what impacts gut, what I focus on as far as in functional medicine, what really actually moves the needle. We'll do some questions and answers at the end of this, the webinar. And then again, we're going to talk about what I do for clients. We're offering a 350 new patient special right now. That basically is a 90 marker blood panel that is also actually 90 minutes of my time. And what basically that means is this is the process of functional medicine. This is actually taking people through a comprehensive process, helping them understand why they have specific issues, rather than, again, just giving people proton pump inhibitors, right? Giving people calcium carbonate Tums, giving people, aloe vera or a leaky gut formula. It's actually figuring out, why do you have gut issues? How is that manifesting as a chronic problem in your life? And then what are we going to do different so that you can get a better outcome in your life? And for some people, that actually literally means, and for really a couple thousand people that I've worked with so far, by addressing gut health, there's a very good chance you can take an autoimmune condition and put it in remission. This is not about curing autoimmune disease. We are not curing autoimmune disease as part of this lecture. I will never tell you that I'm going to cure your autoimmune disease. There is no cure for autoimmune diseases. But you can take your autoimmune condition and put it in remission. You can take chronic brain fog. You can take chronic fatigue. You can take joint pain, and you can make that a thing of the past if you are addressing not just, again, the symptoms, but the physical systems that are at cause. That's how functional medicine works, by understanding your lifestyle, your genetics, your environment, and then changing those factors specific to your condition, that is going to be the path out. Okay? So, I'm going to pull this a little bit close. How we doing? How we doing, webinar folks? All right. We got 13 people on the webinar. What's going on? We got 176 on TikTok. What's going on, TikTok? Hope you guys had a good Wednesday. It's hump day. Let's learn tonight. Okay, let's go deep. Let's figure out what's going on. You guys can throw questions up there as far as the webinar people. TikTok people, don't go crazy. Okay, I'm going to take some questions. I'm going to do more questions towards the end. Okay. Evelise is talking about zonulin already. Yeah, right up my alley. Okay. So someone mentioned mitochondrial function. How are the mitochondria involved as far as the gut? Well, your gut and your liver, right, are one of the actually fastest healing, fastest replicating tissues. You have to actually have a high metabolic capacity. I mean, you have to be able to generate a high level of energy to be able to replicate and heal your gut. When you rob your body's ability to generate energy, and the number one thing that will do that is inflammation. Right? We're only given a certain amount of ATP, right, which is energy. When you're chronically inflamed, you actually start to shut down the ability to produce that energy. And guess what? That's part of the bystander effect. Meaning when you're chronically inflamed, you lose the ability to produce energy. If you don't have energy, you can't regulate your immune system. So every single autoimmune condition, we actually can also call it a mitochondropathy. A mitochondrial dysfunction is really what's actually driving every autoimmune condition. But again, it's still going to go back to what are the major systems that's physically impairing the mitochondria. Again, environmental toxins impair mitochondria. Chronic inflammation, such as from an infection, impairs the mitochondria. Inappropriate levels of beneficial bacteria impair the mitochondria. So we'll talk more about that mitochondria, right? But ultimately, it's going to go back to, hey, what are you doing in your life? What are you not doing in your lifestyle, right? So another big concept behind functional medicine is essentially, right, what are you putting into the system, right? And then what's in excess? That's kind of really what it boils down to. What are you putting into your system on a daily basis? And what is coming out of your system that is in excess? Right, Sherry right there said whole food. Absolutely. Are you putting whole food into your body on a regular basis? But also, what happens when you eat regular food, such as people that have mast cell activation syndrome, and then they still have inflammatory issues? This is one of the issues that we call this the bystander effect. When you're inflamed and you're just reacting. And really, what's going on here is more than likely MCAS, mast cell activation syndrome, is a manifestation of chronic inflammation out of check that's driving leaky gut, and now leaky gut is out of check, and then that's driving histamine release, and that gives you your mast cell activation syndrome. Right? Someone just mentioned right there the carnivore diet. You guys, I was doing the carnivore diet this month. It was not working out for me. So you're going to have people out there, they're going to say, hey, you have to do the diet this way, or you have to do it this diet. That's not how I roll. What I'm going to say is that what is the diet that you need at this moment that's going to help you move beyond the symptoms that you're having on a daily basis? Right? Instead of adhering to a philosophy, how about we actually figure out, well, what do you really actually need right now? I'm telling you guys, when I had my first salad, it was like a miracle. It was amazing. When I had my first, and I was literally day 14, and I had my first salad. And after every single meal of just eating meat, I was still hungry. I was still like craving. But it was what happening was I wasn't getting enough fiber. So fiber is one of these critical pieces, right? Not only does it actually help satiate us, but it actually also helps to regulate inflammation, because fiber is what feeds your commensal organisms. Commensal meaning beneficial. Lactobacillus acidophilus, bifidobacteria, Akkermansia. Maybe you guys have been hearing more about this Akkermansia species, right? So the point is, I'm not saying that carnivore diet isn't beneficial. You look at like Jordan Peterson. I think there's some other celebrities out there that are advocating for carnivore. I think it's a way to do an elimination diet, and especially for people who, again, they're just super inflamed. They don't know where to go. It's a good start, but it's the same thing as I'm going to say as both vegan or vegetarian and carnivore. I don't think that's a long-term solution. I think actually the balance of beneficial fiber, low glycemic, nutrient-dense, brightly colored fruits, and absolutely animal protein is what you're going to need to actually kickstart that healing process. Again, unfortunately, another hallmark sign of a dysfunctional gut is for those people that do not do well with fiber. So if you eat, let's say, raw vegetables, you get constipation, you get bloating, you get gas, you just don't feel good. Borborygmi, that's a kind of cool word. It means like your stomach's kind of talking to you, like talking back to you usually. That's what borborygmi means. But that right there is a very, very strong sign, right? If you're not breaking down fiber well, you may have something called small intestinal bacterial overgrowth. So again, my approach is going to typically to be using specific kinds of fiber at low levels and building that up over time, but we want to ask, what kind of SIBO is it? Why do we have gas and bloating after meals? Again, red flag, the most common symptom that's going to indicate if we have some form of dysbiosis, which just means abnormal ratios of good and bad bacteria, is that when you eat carbohydrates, you get gas and bloating. Anybody get gas and bloating when they eat carbs? Really, really common. Okay? Question up here. Lori says, hey, will the blood panel that we run detect SIBO? No. We're going to run something called the GI map. And that's actually, again, physically going to allow us to look and see what's going on with the microbial populations. Remember, test, don't guess. Always, always, always figure out what is the root cause, but part of that's going to come from good blood work. Part of that will actually come from specialty labs. The bummer is, and this is a consistent theme, is that insurance companies don't cover that GI map. It is what it is. I can't make them change. They don't cover functional medicine as well. It is what it is. It's a bummer. I can't change it. But we're still going to take massive action where we can, and we're still going to do what we can, and that means changing your diet, taking the right supplementation based on what your needs are, but then understanding, again, the underlying system that's driving symptoms. Okay? So here, I want to go from north to south. So in my practice, okay, we take a north to south approach. Like, what do you mean, doctor? In a north to south approach? Okay, well, here we go. We're going down the tube, okay? So let's talk about it. So if we want to actually heal the gut, we go north to south. It's not that hard, right, to think about it. So we're going to actually start the furthest north, okay, is actually the brain. Now again, we know the brain impacts the gut, gut impacts the brain. But one of the things that actually is a fairly common trigger behind leaky gut and chronic inflammation in the gut is if we have damage to the vagus nerve. Vagus nerve comes from the brainstem, physically attaches into via that brainstem, right? The brainstem actually comes out as an actual physical nerve, and that nerve, boom, it actually is in that gut itself. It's doing upwards of 60% of motility in the gut. So the question is, again, has there been significant concussions? Right? So we think about, have we had loss of consciousness? Have we also had issues called adverse childhood experiences, ACE events? And quite frankly, again, just a disorganized childhood is enough to start to change the vagus nerve. You wonder why kids complain about stomach problems, but there's an emotional connection to that? Why do you think that is? Well, that's most likely actually the vagus nerve that's driving gastrointestinal distress, because neurologically, that kid is under stress, or that adult is under chronic stress, and it's impairing the ability for that vagus nerve to work correctly. So Dylan just asked, hey, can a vagus stimulator help that? Yes. So remember, vagus nerve, right? The vagus is, okay, efferent and afferent. So it's a bilateral. What would you want to call that? It goes both ways. You're going to push information from the vagus nerve into the gut, but the gut actually brings information back up to the vagus. So activating cranial nerves, especially those associated with elevating the upper palate. So your soft palate, when it elevates, the cranial nerve that's associated with that actually also activates the vagus nerve. So you'll hear, and you may have read about this already, but singing, gargling, and gagging are all afferent ways, meaning ways that you can actually stimulate the vagus nerve. Okay? Contain yourself, TikTok. I know what you're thinking about. Okay? So the point, though, is that you have to get that loop working. One of the things, again, that's going to actually also disrupt the vagus nerve is going to be, again, cortisol, again, trauma. So one of the best ways that actually we had significant loss of consciousness, actually as far as a therapy, is hyperbaric oxygen. So hyperbaric oxygen therapy has been shown to actually relieve stress on the vagus nerve. And so for people who have actually had true damage through concussion, that's probably one of the first therapies that I recommend for people. It's the more acute it is, and the faster that you actually do that, the more likely it will help. It's hard to make an impact when it's chronic. The other thing that I also highly recommend is something called a QEEG, quantitative electroencephalograph. And what that does, it actually looks, it's just a cap that goes on your head. You put gel in these leads, there's usually 10 leads. You then monitor your brain waves, delta, theta, alpha, and beta. You compare those brain waves, electrical recordings, to normals. There's a database. Anyone who's doing a brain map or this QEEG, it's also called a brain map, okay? There's a 30,000 person database. You guys should compare your brain waves against normals. So the reason, again, why I recommend for this is for people who've had trauma, both physical or emotional, and they also have significant issues such as autoimmunity. Again, adverse childhood experiences, folks, are top 10 as far as a ranking of what has correlation as well as causation for autoimmunity later on in life. So again, many times I'm working with people all over the nation, right, and internationally, is that I'll send them to an office where they can get a brain map, and then I'll evaluate that. I did that in my office for almost 8 years, where I was evaluating brain maps, we were checking them, and then we're doing something called neurofeedback. So again, another way to improve the vagus nerve is neurofeedback, but also mindfulness. So a lot of times, again, you're gonna see a lot of people out there that they're not gonna take meditation and those kind of things serious, but they physically can actually change the plasticity of your brain, meaning they can actually change the physical connections. They can improve the physical connections in your brain as well as improve that vagus nerve. Okay? So it's something else to consider if that's part of your history. Again, the whole point of functional medicine is custom designing what you need based on what your timeline is, based on what your symptoms are, right? And what your labs are. And when you can put all that together, then you can actually come up with an accurate way to navigate a chronic problem. Rather than just saying, oh, you have constipation and you need to take this the rest of your life. It's like, really? Or we could dig a little bit deeper and figure out why you have constipation. There's different approaches in how you can do this, okay? So, D, awesome. Love that you have your Hashimoto's in remission. Good job. So, again, north to south, right? What's next? So we got brain. Put that as 1. 2. How about smelling and chewing? Kind of important. So, chewing. Smelling. Taste. Now, again, the interesting thing is that one of the first things that actually is impaired when it comes to cognitive decline is the lack of the ability to smell and taste. So one of the most reliable symptoms that is indicative of Alzheimer's and dementia is the lack of smell and taste, because that's coming from your temporal lobe. Your temporal lobe is where we also have memory centers. Okay? But importantly here, if we're not chewing our food, like if you guys are speed racers and you're just tearing through your food and you're not chewing, amylase, maltase, isomaltase, all these enzymes actually start with that. And we do all liquids and we actually don't chew, it also confuses our brain as far as our satiety centers. So chewing, and there's a certain amount of chewing that you need to do to also actually tell your brain, hey, I'm hungry. Or I'm not hungry anymore, right? That you slow down that process. So 3. So anyways, chew your food. You guys want better digestive health, okay? Chew your food. 3. Okay, really, LES, lower esophageal sphincter. So I mentioned this because your lower esophageal sphincter, so like look, if we look at your esophagus, okay, and then what's going to happen is that your LES is a band of tissue. It's also called the cardiac sphincter. And then you've got your stomach, right? That's the duodenum. Okay. By the way, I flunked art, so don't give me too much of a hard time. I build stuff. I'm a pretty good carpenter. Whiteboards, that's about as good as it gets. Okay? So, again, this tissue, smooth muscle tissue, is actually physically helping, right, to keep hydrochloric acid from coming up the tube. But if you lose control of your lower esophageal sphincter, right, what's going to happen? If that starts to loosen, yes, you may actually get heartburn at that point. Now, the crazy thing is that I actually tend to use hydrochloric digestive enzymes for heartburn. And that many times work. That many times makes a huge difference. But one of the biggest, again, things that impacts the lower esophageal sphincter, right? Food sensitivities, huge, right? Chronic inflammation from dysbiosis. Cortisol, i.e. stress. Ain't no one got stress. It's 2024. We don't have time for stress, right? But the point is that guess what happens? You go to your doctor, you've got reflux, you've got burping, belching. For some people, they have a silent cough. That person that's always like, 5 minutes later, you're like, dude, Larry, like, go get that checked out. Like, why the hell are you coughing? Right? And what they don't realize is that actually that cough may be a sign of gastroesophageal reflux disease. So rather than assuming you need a proton pump inhibitor, right, PPI, you guys have all heard of these, right? That stands for, what did I say? Purple Poison Incorporated. Omeprazole, pantoprazole, Nexium. So here's the deal. I'm not saying that there's no benefit. No one should be taking that. But what I am saying is that the manufacturer says you should not be taking those for longer than 6 weeks. Has anyone brave enough to raise their hand or put a comment in that they've been taking proton pump inhibitors like Nexium for longer than 6 weeks? Iceman, I'm not taking questions, but you're happy to throw it in there if you want. I'll get questions at the end. This is what I get all the time when I'm doing lectures like this, even just doing regular lives on TikTok. People are being put on these and told they need to take them the rest of their life. There are 3 medications that I hate the most. Antibiotics, steroids, proton pump inhibitors, PPIs. Okay? So the issue, and again, on the package insert in Nexium, it says you should not take this longer than 6 weeks from the manufacturer. Now, again, just clinical experience, if you guys do at some point go off of PPIs, okay, understand that the hormone that's associated with reflux will actually rebound and elevate at about 30 days. So this is where, again, having a plan and knowing what to do is really important before you just drop and you start managing your own medications. So if that, again, if you see a rebound in reflux at 30 days, it does not necessarily mean that the GERD is worse. It means that that hormone is actually rebounding. And then actually, literally, for most people, 2 weeks later, their symptoms will start to drop again. But that's just, again, a little clinical pearl for you guys because people will freak out, right? People are like, oh my God, it's all over. I'm right back where I was. I'm worse. And I'm like, nope. Deglycinated licorice root, aloe vera. Typically, again, if we're addressing root cause, meaning we're pulling away from those food sensitivities, if we're squashing inflammation, if we're getting good testing done like a GI map, and understanding what is driving, again, that lower esophageal sphincter. Again, so just check this out. Alcohol, huge. Okay? Obesity. Yup. Acidic foods. But again, low diversity. Lack of diversity in your microbiome, right? This critical mucosal surface. If you have lack of that diversity in the gut, meaning you weren't breastfed when you were brought up. You were a C-section baby. You're going to have less diversity. If you are living in an urban environment versus a rural environment. It was so hard to say rural. Rural. I feel like Tommy Boy. Road. But literally, that diversity is impacted by where you live. If you live in the city versus if you live in the country. That's what I should have said in the beginning, okay? Can't take myself too serious when I can't pronounce words. So, but the point is that there are specific factors of actually what drives this. In fact, I've been working with a guy, older gentleman, and he's had reflux. He's been on PPIs, numerous rounds of antibiotics, especially after COVID. He was put on steroids. He's put on the Z-Pack, and then boom, he developed reflux. So we've been working with him for 3 weeks now. He's probably watching this right now. And what we found is he had Pseudomonas overgrowth in his gut. But it wasn't just Pseudomonas overgrowth. One of the reasons why he had such a poor outcome going through COVID was that his cortisol was way up here, way too high. His cortisol was unmanaged. So he had stress in his life that he wasn't managing correctly, right? So they called it gastritis, and then they just threw him on proton pump inhibitors. But the reality is that his lower esophageal sphincter was relaxed because of the stress in his life and his lifestyle. And then on top of that, he didn't have a great diet. It was actually better by the time he saw me, but then we just kicked it up a notch. We were like Emerald. Bam! We kicked it up a notch. We pulled out all inflammatory foods. We got him on a 100% gluten-free diet. Nutrient dense, meaning high vegetable, high protein, and not a lot of fruit, but good quality fruit as well. So the point, right, was that literally after 3 weeks of doing this program, once we found on his GI map that he has Pseudomonas overgrowth, now his reflux was already starting to get better. But now we also know that he's got dysbiosis. So now it's like, all right, here we go. We're building momentum. This is exactly what we have to do to get results. You got to remove and reduce the bad guys and emphasize and bring up the good guys. It's not terribly complex. It's just knowing how to get there is what's challenging. Having good, optimal digestion is not the most complex, but it's consistency. It's knowing what labs to run. It's knowing what other systems are also influencing other systems. So one of the other mechanisms this guy had, right, is that he had an increase in what we call beta-glucuronidase. So he had noticed in the past 6 months that his motivation was down, more brain fog. Interestingly enough, his libido wasn't down, but other testosterone-related symptoms were actually present. So what we found on his stool test was he had an elevation of this beta-glucuronidase. So the Pseudomonas in his gut, the Pseudomonas overgrowth, which was again 1,000 times overgrown the top end of the normal lab value. And again, it just blows my mind that doctors don't run these tests. Because again, if 70% of your immune system is in the gut, if your gut is tied to autoimmunity, if your gut is tied to chronic disease, why aren't we testing our gut? Why aren't we basing our treatment off of what is going on in that gut? But also, again, keep in mind, we want to do a PCR-based stool test. So anyways, his beta-glucuronidase was high. But that basically means that the Pseudomonas overgrowth was taking his estrogen from his gut. He wasn't able to actually clear his estrogen because literally the bacteria were utilizing that beta-glucuronidase as a way to recycle estrogen back into his system. So guess what? Estrogen is a growth molecule. It causes your bacteria colonies to grow. So one of the very common symptoms that I'm trying to listen for with women is that, do you notice increased constipation towards the end of your menstrual cycle? Anybody? Yes. Yes. There's a very good chance that, again, bacteria are hijacking your beta-glucuronidase and using it against you. And you would know that if you ran the right testing and how to treat that. Okay, so again, you can use things to decrease estrogen, but if the issue is coming from your gut, you guys, you can take all the DIM, you can take all the broccoli sprout extract that you want, okay? You can take all the Arimidex, anastrozole, those are the medications that are estrogenic. You can take all of the aromatase blockers you want, you will not fix the problem because you're not treating the right thing. So again, it's not so much about let's decrease estrogen, it's about let's look at what is causing the imbalance in estrogen. And yes, that will cause you can get estrogen dominance from your gut health. And then that can keep you in that vicious cycle. Okay? So again, remember, north to south, this is what we're talking about, right? So the lower esophageal sphincter, right? Very common to be an issue. And then 4, okay, is going to be, we'll call that small intestine. But really, we've got a lot of stuff to talk about. No, let's talk a little bit more about stomach. Whoop. Okay. What's the proper pH of the stomach? What should be the proper pH of the stomach? Willie, vitamin D is also connected to all-cause mortality. So I would definitely say omega-3s are great. pH of the stomach is what? What should it be? Well, I'm seeing some basic numbers right there. Anything over 7 is basic. Remember, anything under 7 is acidic. We want the gut to be acidic. So what is the desired pH of the stomach? Two. It's pretty acidic. Now, as you start to hit the small intestine, yes, the pH will start to come up. But guess what? If you do not have acidity in your stomach, you cannot trigger small intestine digestive enzymes. Therefore, everything else south of the stomach is not working correct. Ruh-roh. This is why we go north to south. Because there can be problems in the brain. There can be problems you're not chewing. You can have issues with your lower esophageal sphincter. And obviously you have reflux. We can have problems in your stomach. I mean, literally, we can put 20 different things down here if I had time to talk about that. but I want to hit some of the high notes so you guys can start getting ideas around what might be causing chronic problems for you. Okay? You can test for stomach pH. You can actually swallow these pills now. They'll actually test and measure that. But it's not so much about hyperacidity. It's actually usually typically about lack thereof. Because again, when that bolus of food hits your small intestine, that first section, the duodenum, it needs to be acidic. And if it's not, as the pH, okay, goes higher, 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 guess what? So does the increase of microbial overgrowth, i.e., hydrochloric acid, HCl, right, is inversely related to bacteria. If you don't have enough hydrochloric acid, you're not actually going to handle and control bacteria in your stomach. And then what happens in your small intestine is what we call foobar. Yes, exactly. HCl lowers bacteria. Now there's a HCl challenge that you can do, and actually just continue to take more and more HCl until basically you get some level of heartburn and you pull back. But also, really importantly, in the stomach, you also get absorption of zinc and B12 with intrinsic factor. So there are people going around like all over the place that actually have B12 deficiency issues, numbness, tingling, headaches, brain fog, okay? And they've never been actually screened for B12 deficiency. And when I say B12 deficiency, it is not the B12 serum marker. It's called methylmalonic acid. Methylmalonic acid is the most accurate reflection of B12, not your serum B12. Again, the bummer is that most medical doctors did not take classes on laboratory analysis as it relates to nutritional findings. They're just told, oh, this was a B12 marker, and then we're just going to measure it. And it's highly inaccurate. So again, if you have chronic headaches, especially migraines, numbness and tingling on hands and feet, brain fog and fatigue, those are all cluster symptoms of B12. Autoimmune gastritis, right, atrophic gastritis, which is one version of that is called pernicious anemia, actually requires that you do injectable versions of B12. And that's another vicious circle because, again, pernicious anemia is autoimmune. You're actually making antibodies against your parietal cells or your intrinsic factor. And those people typically need to be on weekly B12 doses. So now, okay, again, north to south, 5, duodenum, right? And really connected into the duodenum is gallbladder. But I want to talk about specifically leaky gut. But again, don't let me forget about this gallbladder thing, because who here has had a cholecystectomy? Who here has had their gallbladder taken out? I can't tell you how often I'm talking to my clients and they'll say, man, like 6 months after my gallbladder surgery or a year after my gallbladder surgery. No, you can't have too much B12. You can't have too much B6. You guys can definitely overdose on B6. You will not overdose on B12. Okay? So we'll talk about gallbladder in a second, but I want to just cover the concept of leaky gut. Okay? There's 7 mechanisms of leaky gut. If you have an autoimmune disease, you have leaky gut. Autoimmunity is genetics, environment, triggers, and intestinal permeability, which is the fancy way to say leaky gut. IP equals leaky gut. So here's what happens. You have a single cell layer in your small intestine. In your small intestine, the surface area of your shag carpet, which sits on that single cell barrier, like if each finger, okay, is a cell, you're going to have an overlap of those cells, and so you're going to have a barrier. On top of the barrier, you're going to have shag carpet, that's called your microvilli, and that is where you absorb all of your nutrients. Magnesium and proteins and fats, amino acids, right? And what sits, right? Willie, it takes about 3 months to fix leaky gut, but I'll get to that in a second, okay? So this is how we absorb, is through our microvilli. Now, I have celiac disease, guys. That means at one point, my shag carpet turned into Berber. Like that's what I'm standing on right now, Berber carpet, right? So shag is what we should have, not Berber so much. Colitis can also cause that, right? So I started getting malabsorption because I had leaky gut, because every time I consumed gluten, it was physically causing an autoimmune attack against that shag carpet. That's what celiac disease is. So the point of this barrier is to keep outside stuff out, right? And inside stuff in. It's a barrier. Every single mucosal surface in your body is a barrier system. Your skin, your lung tissue, you have a blood-brain barrier, you have a urogenital tract, same thing. It's a barrier system. When you start to breach that barrier system, and again, like I said, there's 7 mechanisms behind leaky gut, and I'll mention them all here in a second. But as you start to breach that barrier, because of food sensitivities, or again, bacterial issues, not enough hydrochloric acid, as that barrier starts to break down, you release a chemical that's keeping them nice and tight called zonulin. Okay, so that's one of the first steps. Your zonulin level actually goes up, so you can measure your zonulin levels in the blood and in stool as a reflection of leaky gut. Yes, you can test for leaky gut. So as that barrier starts to break down, right, and you have a massive mucosal surface on the shag carpet, right? You have the majority of your immune system sitting in that surface. So as you start to break that barrier down, you start to let things in through that barrier that was never designed to be, like large molecules, large food molecules, viruses, bacteria, protozoans. That gets into and through that barrier, it gets absorbed into your lymphatics, and it also gets absorbed into your liver. So the point, right, is that as you break that barrier down, what you're doing is you're losing control of your immune system. Because now what's going to happen is you actually start to cross-react against your own tissue. Meaning, for example, gliadin, which is a breakdown of gluten, as an example, gliadin looks very similar to thyroid tissue. So if you are consuming wheat, barley, rye, spelt, etc., right, on a regular basis, that gliadin molecule may look similar enough to things like your thyroid tissue. And as you have that barrier completely open and your immune system is tagging that protein as a problem, and that protein looks similar to another tissue, it's what we call Müllerian mimicry. It just means one thing is looking similar to another. So guess what? Now you're making a cross reaction. Now you're attacking your own tissue. And that is the definition of autoimmunity. But there were specific and exact issues, right, that were actually leading you down the path. So obvious signs that you guys may have leaky gut. Again, you're chronically fatigued. You may have gas and bloating, but you may not actually have digestive symptoms. Very commonly, you're going to have joint pain, stiffness. Also as well, brain fog is classic for leaky gut. Skin issues are rampant with leaky gut problems. But what's also really insidious is because this is a massive inflammatory response that your body's going to have, it starts to suck all of your systems. This is why people will go, like, again, the guy I was talking about, high levels of cortisol, bacterial overgrowth, and then a while after he started dealing with these issues, he started noticing his motivation started to decrease. He started to notice fewer spontaneous erections in the morning. So he was literally losing his testosterone because he was chronically inflamed. So rather than him going and taking a pill, getting an injection, getting a cream, he knew there was something wrong with his gut. He saw his hormones starting to actually drag down. And then he's like, I don't know what to do, but I saw this guy on TikTok and I got a consult with him and I've been working with him. So again, 3 weeks into his care plan, he's feeling phenomenally better. And again, it's not because I'm not giving people anti-inflammatories. I'm not just giving people fish oil and saying like, you're good. I'm going, no. What are the things that you're doing on a daily basis with your diet? What supplementation are you taking, right? Where are your hormones at? What do we need to adjust? What do you need to start doing better in your lifestyle so you handle stress better? That's my approach, but I think it works. Okay? All right, Katie Long. That's awesome, man. I'm excited to see you soon too. So Christine is talking about C-reactive protein, so you guys understand what C-reactive protein is. Again, it's actually in the gut, in the small intestine, you have things called toll-like receptors. So does anyone else have elevated issues, C-reactive protein, especially that HS C-reactive protein? Okay, Claire, yeah. Okay, so check this out. If you guys are dealing with C-reactive protein, what actually stimulates the production of C-reactive protein in your liver, they're called toll-like receptors. Guess where toll-like receptors are? On mucosal surfaces. So especially when we have imbalances in beneficial versus non-beneficial bacteria, so we call that dysbiosis, okay, activates toll-like receptors. Toll-like receptors in the liver increases the production of interleukin 1, 6, and TNF alpha. Those three combined are called C-reactive protein. Okay? So instead of taking Enbrel or Humira TNF alpha blockers, how about we actually just go backwards and fix the dysbiosis? Again, guys, I love resveratrol. I love turmeric. Okay, I love boswellia. I love fish oils. It's not going to fix the C-reactive protein issue. It won't. I can't tell you. I've been in practice for 15 years. When you're in practice, you practice. You make mistakes is actually what you do. That's what practice is. Okay? So the point being that instead of, again, treating a number, treat the person who has the number. Figure out why they have the elevation of HS-CRP. And it's actually critical that you do that because the longer and the higher the number, the more likely we're going to have heart attacks and strokes. We're going to have vascular inflammation, atherosclerosis, dementia. Big problems. In fact, actually, exceptionally high levels of C-reactive protein also correlate to cancer risk. So I won't be giving you just a pill to fix the ill. It's not how I roll. I go north to south. We look at the brain. Are you actually chewing? What's going on with your low esophageal sphincter? Is it working correctly? What's going on with the stomach acidity, right? What's going on with your small intestine? Do you have leaky gut? So I mentioned again that there's 7 mechanisms behind leaky gut. I'll give you guys those right now. Okay, it is diet and diet and diet, and that's probably going to make up more than 50% of what actually causes leaky gut. Second is medications. I already named them. But again, corticosteroids, antibiotics, antacids, also something called xenobiotics. What are xenobiotics? Well, the definition of a xenobiotic is it's a foreign chemical that essentially reduces bacterial populations in your gut, i.e. plastic. New research just got released showing that like all of the plastic water bottles that you guys buy in stores have microplastics in them. And the average American is consuming a credit card's worth of plastic every week. Plastics will upregulate estrogen. Plastics will, again, dampen testosterone, but plastics also actually, again, destroy your microbiome. Stop drinking water from plastic bottles. Please. Stop putting perfume or parfum from cosmetics on your skin. They are estrogen mimicking chemicals. If you guys want to detox your system, you eat lean protein, vegetables, especially cruciferous vegetables, fruit, you avoid chemicals, exposures, detergents, get that crap out of your body, eat organic, liberal amounts of high quality water, you exercise, you sleep, and most importantly, you defecate. If you're not sweating, if you're not going to the bathroom, you are retoxing. Betty is asking, Bethy, what kind of water should you drink? If you guys are on municipal sources, highly recommend RO. You can add minerals in after it. Berkey is decent, or again, at the very least, a charcoal filter should be used. Spring water is good, but again, not if it's in plastic containers. So there's different routes you can go as far as that goes. I have well water, and I've had issues with my well that I've had to treat. So wells are not perfect, but again, I think the quality of the water that comes from a well is pretty good. I still have a whole house filtration system for my well water. Okay? So back to what we were saying is we got this leaky gut issue. We got diet, we got medications causing leaky gut, infections. Again, Helicobacter pylori, bacterial overgrowth, parasitic yeast, even viral-based issues in the gut can cause leaky gut. Stress is a massive trigger. Okay, cortisol is a big deal. Hormonal, low levels of thyroid hormones. Anyone with hypothyroidism? Hypothyroidism is a main culprit for the onset of leaky gut. Yikes! How do you know if you have hypothyroidism? Your T4 is low, your TSH is high. Just because you have an elevated TSH does not actually mean that you're hypothyroid. It may just mean that you have Hashimoto's. It may just mean that you have an autoimmune attack going on against your thyroid. It may just mean that you have toxicity and your thyroid is responding. So again, hormonal, progesterone, cortisol, testosterone, and thyroid. Neurologic issues, we've already talked about that. The vagus nerve, and metabolic. Meaning, if your blood sugar is spiking and it's dipping, you're driving leaky gut more than likely. We're fatiguing after meals and craving sugar after meals. That is a sign and most common symptom of insulin resistance. If we're shaky, irritable, lightheaded in between meals, that is the most common symptom of hypoglycemia. So if you feel better after you eat, hypoglycemic. If you feel worse after you eat, insulin resistant. Austin, there's 8 markers for thyroid disease that you need to test at a minimum, okay? Reverse T3, TSH, antithyroid peroxidase, antithyroid globulin antibodies. That's 4. The other 4 are free T3, free T4, total T3, total T4. 8 markers for a good thyroid panel. Okay, again, we run a 90 marker panel on all of our new patients that we run in our virtual practice. Every single client is going to get those 8 markers on their thyroid. So again, having a thyroid problem can cause gut symptoms, but gut issues are going to drive thyroid issues. So just taking a thyroid replacement medication, guess what? You take your thyroid replacement medication and you're kind of wondering when that's going to kick in because you're still cold, you're still fatigued, you still got brain fog, your skin sucks, your hair sucks, your nails break, and you're like, when is it going to kick in? Do I take a higher dose? But you can take a higher dose of a thyroid medication, and then you're getting heart palpitations, you're getting nervousness, your hair is starting to fall out, and you're getting insomnia. Jen. That's me. Yes, I understand. I've seen over 2,500 cases of Hashimoto's in my practice over 15 years. It's the #1 client that we work with at Dr. Autoimmune. Someone said, my fasting blood sugar spikes when the Dallas Cowboys lose. I'm sorry, you're probably going to have to get used to that. I don't foresee that changing in the near future. Okay? So, again, blood sugar is a big deal. This is also why probably about 8 to 9 out of 10 of our clients will get one of these devices. So this is called a continuous glucose monitor. You can put this on your abdomen, you can put this on your tricep, and basically what this does is it puts a transmitter right in through your skin. It has an adhesive that holds it there, lasts 15 days, and it Bluetooths your blood sugar numbers to your phone. It'll tell you exactly what you're doing and if you're maintaining your range between 80 to 120, because that's your optimal blood sugar range. Now, the interesting thing is that the longer someone is insulin resistant and the more severe their insulin resistance is that directly relates to number 7, which is your pancreas. Again, we'll go back to gallbladder here in a second, okay? We're going north to south, right? But your pancreas releases an enzyme called elastase. Is anybody learning anything yet tonight? Are we learning anything? Anybody out there? Okay. By the way, guys, what we'll do is if you guys did not come in at the beginning of this lecture, what I want you to do is email info@drautoimmune.com. I'm going to load this video onto YouTube, and we'll send you guys a YouTube link. So if you guys can't watch the full webinar, if you guys came in late and you missed some of the initial stuff that we were talking about, I want you to email info@drautoimmune.com. And again, tonight, I'm going to try to load up that this video to YouTube, and then we'll actually email you guys the link. Okay? So, Lisa, awesome. I love that you're learning from this too. It's Lisa. Lisa was a NP, and she's saying that she's learning. You can never really get away from learning more. There's so much to learn. So this is what I've learned, right, over 15 years. The more you know, the more I feel like I don't know. You guys know what I'm saying? Like, the more you learn about, like, medicine, the more you learn about managing chronic illness, the more that you work with people. Like, I see the same patterns, but the more I realize, God, it's so complex. I feel like I don't know anything. So there's always more to be learned, right? And this is that attitude, I think, is really important because you got to keep yourself humble. So if you think you know everything, oh man, God is going to throw a curveball for sure. He's going to humble you. So, but again, the bummer is that we have specialists, and they work in their little box, and like if you don't fit in that box, they're like, well, I don't know what to do with you. Or you need to go to the psychiatrist. You guys ever gotten that one before? Well, your TSH is normal, and I'm sorry you're having depression and anxiety, so we're going to send you to the psychiatrist. And you're like, no, like, I don't want to take drugs to fix this issue. Could we please look at the root causes of why this is happening in the first place? So again, for me, because like when you talk about like serotonin, like your feel-good neurotransmitter, partly also how we manage pain, and also dopamine, like your relationships with other people, whether you want to isolate yourself, your temper, how nice you treat yourself. You guys, the vast majority of serotonin and dopamine, it's made right there. I can't tell you how many anxiety and depression cases no longer have anxiety and depression because they actually just focused on their gut health, they focused on their blood sugar, they focused on exercise, they focused on proper sleep, they started examining their relationships, and they started asking hard questions. So FN Fragrances is asking, can antibiotics mess up liver and kidney function? And the answer is 100% absolutely yes. If you guys have actually had random elevations in liver enzymes, one of the main causes of that is going to be dysbiosis and leaky gut. Now, if you have high levels of white blood cells or very, very low levels of white blood cells, and you're seeing AST, ALT, alkaline phosphatase, etc., enzymes also elevated significantly, you need to rule out some serious diseases. Because you may have hepatitis. Guess what? People with hepatitis, their gut doesn't work well. So again, back to what we were saying. Pancreas, your ability to release carbohydrate-based enzymes such as elastase is directly tied to your blood sugar. If you guys have insulin resistance, there's a very good chance that it actually is also facilitating small intestinal bacterial overgrowth. Meaning if you guys get gas and bloating after meals, one of the mechanisms may be that your blood sugar is actually driving SIBO. And guess what? You will figure it out with what's causing that when you actually utilize these glucose devices. On top of the fact that you need to have good stool testing because you need to support that pancreatic digestive enzyme because you do need to break your carbohydrates down because as they get further and further down the gut, they're going to ferment. And that means you're going to feel terrible as that gas and bloating starts to build up in your system. As you feel like you're 9 months pregnant, right? Like, again, hear that all the time. Oh my gosh, by the end of the day, I feel like I'm 7 months pregnant. And I'm like, yeah, because you're fermenting. And so that starts north, south. Now, if you've had your gallbladder taken out, again, more than likely, you need bile salts. You've never been told that you need bile salts, but you need to start taking bile salts because that's what your gallbladder was releasing. You'll still make bile salts, but you'll actually slow down your release of those bile salts, especially as you have larger fatty meals. You may still be getting symptoms. On top of the fact that bile, when it's released, is partly what also keeps microbial colonies in check. So those people that, again, have had their gallbladder removed or had sluggish bile for years are also set up for dysbiosis. Again, abnormal ratios of good to bad bacteria. So if you are restricting fats from your diet, guess what? Not only are you harming yourself, but it's probably more or less a symptom that your gallbladder is not working correctly, and you need to treat that. Otherwise, your gut's never going to come back online. Destiny Cook, dysglycemia. High and low blood sugar. Yes, most people actually have problems with both. Okay, Jamie, I'm not sure if you're monitoring TikTok. Some weird stuff. LeBron has 60 points. No, we're not talking about LeBron. Okay. Okay, thank you. Appreciate it. So, back to what we were talking about. Okay, again. Gut health is huge. How do we get the gut back on track? There's different ways to do it. You guys can DIY, right? Hold on one sec. Turn that heater off. Woo! It's getting hot in here. So, how do we fix this? Again, where we started with was understanding how systems drive symptoms. We don't want to just rely on, oh, you have constipation for longer than 6 months and you've got tummy problems and so you have IBS. Guys, IBS is a waste basket diagnosis. Fibromyalgia is a waste basket syndrome. Yes, you might have fibromyalgia. Yes, you might have IBS, but it's because they've excluded other things and then they just kind of land you in that bucket. It means nothing except for they're going to give you medications which probably have a lot of side effects and you may or may not like them. Nor is it whatsoever dealing with the actual physiology that's wrong and getting you to where you need to be, which is your optimal health, the best version of yourself, the best mom you can be, the best dad you can be, the best employee, right? None of that is moving the needle in that direction. You guys can take supplements and throw it at the car and figure out what's sticking, so to speak. Or you can go through a more systematic and organized approach to understand what are those mechanisms. So let's talk about that. Like, again, I've been doing this for 15 years. I've done it wrong. What I'm doing is not perfect, but I've definitely refined what I've done over the years. And the reason is because I'm better now than I was 15 years ago. It's faster to actually help people with their symptoms. It seems to cost people less as I get more efficient. That's good for people. We all need to spend money on like organic groceries. They're expensive. Then throwing it all at your functional medicine doctor or your Western doctor or your pharmacist or the supplement of the day from TikTok. So how can we organize this and make this more efficient? Let's actually talk about that. So I think when it comes down to it, right, we can talk about the foundation. Okay. One is going to be diet. I'm going to be more of a paleo guy. Okay. It's not that I don't sometimes eat grains. I'm not eating them in January, but sometimes I do. But I have to be careful and I have to limit what I'm doing because I can certainly push that. And I go outside of what my tolerance is and I will start to ferment. I will start to push myself towards dysbiosis. I can easily reactivate my celiac disease just like that if I if I have one exposure to gluten. So again, the crazy thing is that for me on the diet side, there's certain things I have forgiveness with and there's certain things that I do not. You guys need to know what that is for you. And that really, again, is going through what we call an elimination and provocation. It's with the C, it's not a K. Okay, provoke. But that means we're pulling out inflammatory foods and then we're eventually bringing those foods back in. Again, however, there are exceptions. So for example, if you do have non-celiac gluten sensitivity, all right, the most common cause, probably one of the most common causes of leaky gut, then you need to know that and you probably need to be closer to a 100% compliance. So that's where we're going to say, hey, look, let's run this test. It's called a wheat zoomer. It'll tell you. That'll be part of the care plan that we work up for you. You can do these lab tests that will tell us, do you need to be 100%? Okay? Connie, I've never seen any research about vagus nerve stimulation and celiac disease. Okay? But if you know articles, then send them my way. Yeah, so again, right, Joe Mama is saying, hey, shocked that corn caused a lot of bloating. Again, corn is great for checking transit time, like whole corn. Again, some people can handle it, some people can't. For some people, it's going to spike their blood sugar. For some people, it won't. So figuring out, is that the case for you? That's a good experiment to go through. The problem with elimination and provocation diets, I'll just say this, okay? Again, I've done thousands of these with clients. Unless you fix the root causes, just pulling foods out and bringing them back in is not going to fix you long term. It's part of the process. All right, so that's one aspect. Two, again, we can just talk about labs. Again, I do a 90 marker panel. I mean, knowing where your vitamin D status is, knowing if you have low levels of iron, i.e. ferritin, understanding where your hormones are at, right? Hormones influence gut health. Gut health influences hormones. We talked about that tonight. But a very detailed, again, I do a 90, oh my gosh, 90 panel because that's a good starting place. Blood chemistry for me is probably the best diagnostic test, cost-wise, and the volume of information that you get from it. You want to look at optimal ranges and lab reference ranges. Optimal ranges are more narrow. Lab reference ranges are larger because they're factoring in unhealthy people. And your provider should know how to read both. Okay? Guess what? Number one cause behind hemochromatosis is insulin resistance, Biddy Charb. So 3, okay? And really beyond that, that's the GI map, right? That's the Dutch, okay? Do you have, that's other vibrant panels. Do you have mold issues? Do we have Lyme issues? Again, those can be determined through a very good history and looking at your basic blood panel to help you figure out what additional labs should you begin. Because again, the whole point behind testing is so that you are not guessing. That's it. Okay? 3. Okay, like I mentioned, very commonly I'm using continuous glucose monitors with probably about 8 to 9 out of 10 of my clients. So probably about 80% of my practice, they're getting a continuous glucose monitor because the vast majority of people that are coming to me are showing signs of insulin resistance. That has to be in check if we want to have good gut health, but if we want to have good immune system health as well. Okay, 4, we need to look at lifestyle, sleep, exercise, non-negotiable. Poor sleep hygiene will lead to more insulin resistance. Insulin resistance issues leads to poor decisions. Poor decisions lead to poor gut health. And we go around and around and around. Exercise is one of the most effective ways of handling stress. When we don't have adequate stress tolerance, again, promotes insulin resistance, inhibits your good bacteria in your gut. Okay?
I'm trying, babe.
5, supplementation. Massive. If we're using the right supplements, i.e. to the right system, okay, you are going to see a significant impact, and not in months. We're talking days, if at the most weeks. Utilizing the right prebiotics, the right probiotics, right? Prebiotics and probiotics are huge. You can get prebiotics from your food. You can take prebiotics from me. The difference is that I've formulated these products versus going out and trying to find ones that work for you. When you actually start to take custom supplementation to your specific issues, your symptoms will change. Not only that, but yes, your labs will change too. So again, this is not just about throwing vitamin D at somebody, throwing an enzyme at somebody, throwing a probiotic at somebody. It's looking at explicitly why you have problems and then customizing supplementation to that. Most supplementation, remember, again, is corrective. You correct the issues and then you figure out how do you maintain that through your lifestyle, through your diet, through exercise, through good sleep hygiene, through healthy relationships. And I should put down here, really, again, is environment. Because again, if we have an unhealthy environment, if we're living in mold, right? If we're consuming toxins, if you're throwing fire on the back end and you're trying to hose down the fire from the front end, it doesn't work. You have to figure out, again, if there is an environmental component. So we don't have enough time to really go through that. There's a whole lecture that I give on environment and chronic illness. And maybe we'll do that soon. There's great resources from a man named Walter Crinion, if you guys are interested in that, Crinion. He's who taught my master's program in the environmental module that I did. He's no longer with us. God bless his soul. But he is a really, really good resource. Okay? So again, right now, we are running a new client special, and that is $350. So what that basically includes is a 90 marker blood panel that is drop shipped to your house. You get a 90-minute consult with me when that's ready. I sit down with you and your spouse. Why? Because your spouse should be the person that's supporting you the most. They should be understanding of why you're doing this, why you're changing your diet, why their diet is probably changing, why their diet should change to support you. The whole point of a spouse should be someone who is supporting you. And that's why I want them to be there at that consult. We tell all of our clients, we don't accept everyone. It's not because we're mean, it's because we don't want to waste your time and we don't want to waste our time. So you need to be willing to take supplements, you need to be willing to change your diet, and you need to be motivated. That's all I need. Literally, that's all I need, because I'm going to take you by the hand and I'm going to take you through this process. We have a clinical nutritionist. Her name is Stevie. She is an amazing human being. She is good at what she does. And she will take you through that elimination and provocation process, but she's also going to show you how to use the diet therapeutically and how to maintain yourself with diet. Well, I'm so busy. Oh, yep, she'll show you how to do that too. Okay? So what you need to do at this point is, if you want to take advantage of this, so this is both my time and the blood work. It doesn't include supplements. It doesn't include additional specialty labs like the GI map. I don't know what you guys need right now, okay? I'm not going to throw labs at you guys unless you need them. The point of labs are to change my recommendations, because I'm going to give you a care plan if I think I can help you. That's the whole point of this. Okay, Christine, it is completely dependent on what you need, how long it takes, and quite frankly, what your income is. I understand that there's people on this end of the income scale that can afford anything I throw at them, and there are people over here that cannot do that. So it's a conversation to have. That's not part of my basis of whether or not I accept you. That's not based on your income. It's based on your willingness to change. If I feel like I actually have a mechanism of what's going on, I'll work with you. I work with single moms, with single dads. We have Care Credit in the office, which allows people to spread their payments out over time. That's not what's important to me. I was put here to change your life. And that happens at one step at a time. So we have to, again, figure out what's going on. What are we going to do about that? How are we tracking you? How am I going to show you that what you're doing is working? Not just through your symptoms, your gas and your bloating and your energy levels and your joint pains going away, but also, can I show you in labs through repeat testing that, hey, wow, your C-reactive protein came down. Your ferritin levels came up. Oh my gosh. My ANA, my anti-nuclear antibody levels started to drop. This is the stuff that we see on a regular basis, week in, week out. So what you need to do is, if you guys are in the webinar, there's going to be a link And I see that there's some questions here too. So we'll get to those questions in just a second, okay? But there is in the chat, there should be a link. There it is, the drautoimmune.com remote new patient. And for you guys on TikTok, you 250 beautiful people, okay? Yeah, I'm talking to you. You guys in my link tree in my bio, so if you punch my little link, okay, then that will pull up that 350. You'll pay for that. That will schedule a discovery call, right? So discovery call is scheduled immediately after you pay for the new patient evaluation. From there, right, you book it. It's a 20-minute phone call. You'll talk to my staff member. Her name is Nancy. She's very nice, very helpful. She's going to answer any questions like, does my insurance cover this? No. I'm going to say that, okay, because I know you guys have that question. I'm going to answer it already. They don't cover functional medicine. I'm sorry, I apologize. I can't change that. But the point is, you'll get a discovery call. You'll get set up with everything you need. And then once we get your blood work back, so get your blood work done quick, okay? Once you get that done, and it's usually about 2 weeks for that to come back, you are back on my schedule. Then we will go through that initial patient process. Then we go north to south. We start asking, hopefully, smart questions. I'm engaging you, talking to you about things that I think that are at issue, and we start coming up with a plan. That's it. It's not harder than that. Okay? So let's not make it difficult. But I'm going to take some time. We're going to answer some questions, and then I will bid you guys good night. All right, so Melanie, if we want an acidic stomach, is it bad to drink spring water, 8.5 alkaline? Yes, absolutely hate it. I think it's a complete, my gosh, it's just another reason that's keeping people sick. You guys need to stop drinking high pH water. It's a waste of money and you're actually making yourselves worse. Say no to high pH water, okay? Silrog at Comcast, may have autoimmune hepatitis now based on smooth muscle antibody testing. From my research, this can only be treated with steroids. What else can I do? So that's from a Western perspective. Again, if you have autoimmune hepatitis, that is not the only thing that I've actually seen as far as work for autoimmune hepatitis. But you do need to figure out what causes autoimmune hepatitis. So for example, I already mentioned this, okay? But yes, viral infections can cross-react and go after liver tissue. I've seen dysbiosis cases cause autoimmune hepatitis. Glutathione is massively important when it comes to liver function. So this is also why commonly, guys, I'm recommending something called NAC, also selenium. Those are the two nutrients that you need to produce glutathione. Melanie, again, do you know if oil of oregano kills good gut bacteria? Yeah, so Melanie, you will kill beneficial bacteria with oil of oregano if your dosage is too high and your therapeutic window is too long. So you do need to be careful with that. When I use oregano oil, like oregano, phenomenal for fungal overgrowth. Oregano, phenomenal as an antiparasitic. There's peer-reviewed research that backs that up. So I don't tend to use a lot of oregano when it comes to bacteria. I use other formulas if I'm using antimicrobials. Okay, Vance, how do you fix insulin resistance? Vance, again, right here. Follow that, track that. You will see your A1C do amazing things when you're utilizing this appropriate. But very commonly, one of the most underdiagnosed causes of insulin resistance is gut health, Vance. Okay, so Sylvia, what do you think about microcurrent, PMF, and red light therapy? So, hey, Sylvia, hi. I'm so excited that you're on a live. Man, I love that you're here. So I use PEMF, so pulsed electromagnetic field therapy. I'm a huge fan, again, of PEMF. Microcurrent, I don't have as much experience with, although I've been told microcurrent is great. And then red light therapy, I think, is also awesome too. I think red light therapy is pretty expensive though too. Sylvia, as far as a returning client special, we will honor the price as far as on that those labs. But Sylvia, what I'd have you do is email info@drautoimmune.com, okay? Because that's a different deal as far as for returning clients. It's okay. It's all right. And then, again, anyone else right now who needs a replay of the webinar that I just did, you just need to email info@drautoimmune.com. Okay. So again, info@drautoimmune.com. I'm going to take this webinar and I'm going to actually load this up to YouTube so you guys can actually listen to this. Okay, so Marinella, can having as a child dysentery lead to leaky gut? No, dysentery causes leaky gut. So also cholera. So interesting, again, Alessio Fasana, who figured out zonulin, which is the main mechanism, again, that's what holding the cells tight together in your gut. Alessio Fasano, he's the doctor who figured out the mechanism behind celiac disease. Well, he was trying to develop vaccines for cholera. It turned out he made cholera way worse through his vaccines. But what he determined was the actual mechanism behind the diarrhea that he caused was this significant increase in zonulin. And then he started to think, well, could that be one of the mechanisms that actually, again, is driving autoimmunity? It turns out, yes, that is like one of the very mechanisms that drives that. Okay. Mom, wife, and caregiver. Fibromyalgia equals SIBO, small intestinal bacterial overgrowth. Until proven otherwise, I am assuming that fibromyalgia is actually SIBO. And again, what happens, remember, is that 90% of your serotonin is made in your small intestine. It's in your gut. So when you can't produce serotonin, guess what happens? You lose the ability to regulate inflammation, and inflammation will drive something called central sensitization, and that's the mechanism behind fibromyalgia. Also AMPS, AMPS, which is basically childhood fibromyalgia. So there's all these kids out there that are developing fibromyalgia. They call it AMPS. I'm telling you, it's a dysregulated immune system, very commonly because of gastrointestinal tract, but also because of toxicants that these kids were given. And there's lots of examples of those, but I'm not going to turn into one of those lectures. So again, guys, last call. Again, new patient special. Grab that. You guys in the webinar have that. For you guys in the TikTok world, again, $350 is what we're offering. That is, again, a 90-minute consult with me. That's a 90-marker blood panel. You do need to be serious about this. You got to be willing to change your diet. You need to be willing, right, to take supplementation. That's not the rest of your life, but you need to figure out what your root causes are, and that's my job. But you need to be able to show up willing. So grab that link in the bio, and you'll get set up with a discovery call as well as the payment that you'll make. And then that is your phone call with staff, and then they will get you set up with the test kit, and then we'll get you into the office and we'll go through the functional medicine process. Okay? Again, the new patient special is a 90-minute consult with me. Again, I've been practicing functional medicine for 15 years, over 5,000 clients. We have over an 85% success rate with our clients currently. Okay? It is a 90-marker blood panel. And again, it's basically the evaluation of about 16 pages of paperwork. So we're very, very thorough and comprehensive. And again, if I feel confident that I can help you, then I'll detail what are your next steps. If you guys are going, oh my gosh, I don't know if I can afford it, look, just book the $350, talk to my staff. If you don't feel like you can do it, we'll just refund you. It's not a big deal. We don't use high pressure. There's no sales tactics. It's not it. I just say, this is what's going on. I should blow the doors on your expectations. You should be walking out of my consult, walking, right? My virtual consult, going, holy crap. He just pointed out all these issues that I have. No other doctor has pointed that out. I feel so confident that he's going to help me. And that's exactly how you should feel with a doctor. It's not about being pressured. It's not about any of that crap. It's about bonding with a human being and feeling confident that they're going to take care of you and give you an experience that's going to lead you to the best version of yourself. Okay, guys, appreciate everyone here. We'll talk to you guys soon. We'll see you on the next live. Again, this is Dr. Ian, Dr. Autoimmune. Do we have any other last minute questions? Yep, again, replays of the webinar, info@drautoimmune.com. Melanie, do you know what causes sluggish bile? Yes. So again, insulin resistance will cause sluggish bile. If you're having gluten sensitivity, that'll cause sluggish bile. Lack of protein will actually also, so again, deficiencies of protein can cause sluggish bile. Hypothyroidism will cause bile-related issues. Very, very common indication that there actually needs to be an investigation of thyroid disease if you have a gallbladder issue, but also celiac disease and non-celiac wheat sensitivity can also impact your gallbladder function. Whew. That's all I got for the night. Okay, you guys are awesome. Appreciate you. And again, anything else, you guys just reach out and we'll do what we can to help you. Again, this is Dr. Ian, Dr. Autoimmune. God bless.